Hi, everyone. My name is Rebecca Flores, and I am here with Kayla Gurnitz. And we are excited to have her as our guest speaker for today. Um, and if there's any questions or anything further, please put it in the chat. And Kayla, I'll pass it to you.
Awesome, thank you. So hello, everybody. My name is Kayla. I currently work as a business development representative for a inpatient acute stabilization hospital, which is quite a mouthful, right? And even my title is interesting, right? What is a business development representative? And it can mean a lot of different things depending on which area you are working in. So I'd like to start just by talking a little bit about my career path and what led me to what I'm doing today. And my journey is not like many others, but also very similar to many people that I know, because I was fresh out of high school and knew that I was going to be a pharmacist, which means you have to be very good at chemistry. And I thought that I was, and learned very quickly in my undergrad that chemistry and math was not quite my jam, so to say. And at that point, I had gone to school. My undergrad degree was supposed to be in what was called pre-pharmacy. So it wasn't going to be a specific type of degree. It was just pre-pharmacy, meaning all of my classes were to gear me up to enter into pharmacy school. And where I went was University of Iowa in the lovely cornfield state of Iowa. And there, the program had, so you would do 2 years of undergrad in the pre-pharmacy program, and then hopefully get accepted into their pharmacy program. So after 6 years, you would graduate with your PharmD and be able to start working as a pharmacist. What that means is the classes I was taking the first year, when I finally realized pharmacy was not for me, were all geared towards pharmacy. So they weren't credits that were going to transfer into any other major, really. Some of the gen eds possibly, but the path that I took, I wanted to get all of those core classes out of the way first. Big mistake. Always recommend that if you're going and planning on school, start with any of the gen eds so that you know that you are not wasting your time and money, right? Because college is not cheap for anybody. So, I'm decided not on pharmacy. I was thinking healthcare, though. I knew that I needed to work in healthcare in some way. And I got my very first big girl job, so to say, at working as a psychiatric nursing assistant. I was fortunate enough that when I was in high school, I did receive my CNA through a program that my high school offered. So that set me apart from some of the other candidates in that role. Uh, and there I worked in a medicine psychiatry unit. And a medicine psychiatry unit means that we are seeing patients who are there with a very acute psychiatric disorder, but also a very real medical issue going on too. So it doesn't look like where I work today. We had all of the medical supplies and cameras and everything so that people wouldn't hurt themselves while they were in our care. And during that time, I realized psych side I loved, medical side I hated. So I took a step back and really started to look at different career options that I might have and what degree might be a good thing for me. And at this point, I'm starting to just take those general classes that can probably transfer throughout a few different degree options. So around the same time that I decided to actually move to Colorado to finish my degree at Metropolitan State University of Denver, which I will always say is the best program that I ever did and best school that I ever went to. There I chose, because of my personal journey with mental health, I had been somebody who during high school was in and out of inpatient treatment, and I did some outpatient programs. I was seeing a therapist, a psychiatrist. I had the whole gambit of things growing up. And I knew that there was something there that I wanted to give back and start to do. So I chose to do my bachelor's degree in human services and mental health counseling. With that, I was fortunate enough that Metro has you do an internship and practicum for I had to do 1,000 hours of this before I graduated. So they made sure you knew what you wanted to do. And there I worked on the more clinical side. So I worked with domestic violence victims with the judicial system. And then I worked with the offenders of domestic violence in a clinical role. which led me to my very first job after I received my bachelor's degree. And that was working with domestic violence offenders and then those that had a DUI, so needed to do substance use treatment. So I was running the groups, doing the assessments, all that fun stuff. During this time that I was working with Aurora Mental Health in a forensic therapist role, they had got new leadership and were kind of doing an overhaul on all of their programs. And ours was one, unfortunately, that had really high community need because people were court mandated to do our treatment, but unfortunately had the lowest financial gain for the organization. So we ended up losing the program. Once we lost the program, I had 1,000 things on my mind of how we could have saved this program, right? And at this point, I had no idea the role that I'm currently in existed. I didn't know what business development was, had no idea any of the administrative side of behavioral health. I thought to be in behavioral health, you had to be a therapist, you had to be a case manager, you had to be boots on the ground in front of the clients. And now I know that that's not the case, and you can make a huge impact on the administrative side of behavioral health or even just medical health care. Went back to school to do my master's in organizational leadership, and my emphasis was human capital. My goal with that was I was going to be in HR, save the day with HR. And I did recruiting. So when I started with Peakview Behavioral Health, I actually worked as their talent acquisition specialist, which just meant that I was looking at tons of resumes a day and trying to find a candidate that would be a great fit for our organization. And to be honest, it's a really tough job working in recruiting just because you have to say no to so many people, and these people need a job, right? We need a job so that we can pay our bills, so we can go on vacation, so we can take care of our family members. And so I was getting pretty burnt out, but I knew that I was in the right place. I knew that at the administrative side of behavioral health was something that was already fitting really well with my personal values and my professional goals. So I was fortunate enough that Peakview had a role open as a business development representative, and I had no idea what this role was. I just knew that I wanted it. So I'll talk to you a little bit about what a business development representative is in behavioral health care, because it looks a lot different if you've ever met or heard of somebody who is a business development rep or a sales development rep in any other field, really. Our goal as a business development rep, or sometimes called outreach or community liaison, is to be a member working for the community and getting the community side of feedback and input, and then implementing that into the hospital. So some of my main roles that I currently have are making sure that what we are doing in the hospital is meeting the community needs. So are we seeing the right population? So right now I guess I'll explain what Peakview Behavioral Health is, right? That's probably smart. Peakview Behavioral Health is a 112-bed acute stabilization facility located in Colorado Springs. We see adults and adolescents with psychiatric disorders, and then we also do detox and dual diagnosis, which just means that somebody has a substance use diagnosis as well as a mental health diagnosis. Adolescents, we see ages 13 and up. As of now, any inpatient facility in Colorado had recently changed their ages. We used to all be able to see 12 and up. Some were seeing 11 and up. And Colorado, as they do, changed some regulations. And so we had to switch our age range to 13 and up. And one thing that we're starting to see in the community is this huge gap in adolescent care, mostly for pediatrics. So ages like 7 to 12 needing care somewhere. So as we see this in the community, because I'm out in the community every single day, meeting with therapists, psychiatrists, doctors' offices, hospitals, I'm always interested in what are they seeing. And we kept hearing that they were seeing a need for pediatrics. So we started to do construction of December of what was last year? 2022 is when we started the construction. So, and our hopes were that we'd have 32 more beds being brought online to fill that gap in inpatient care in Colorado this year. And so far, it's like this close. There's a lot of red tape when you have to open up a facility like ours. We have to have ligature safe, meaning that somebody can't take any of the things off of the walls or in the bathrooms that they could possibly hurt themselves with, and a whole bunch of other compliance issues there. So we are close to opening those 32 new units, and because what we kept hearing in the community was a pediatric need, one of those units will be that. If it wasn't for a business development rep knowing and hearing all of these things in the community, what would be implemented in the hospital is what we think the community needs. So we're there to make sure that we are actually doing what the community needs. Another huge part of our role is networking and connecting with the community. So we function as kind of in a sales role, marketing, I would say, which can have some difficulties in behavioral health, because at the end of the day, what we're selling is technically a person. And so there's a lot of ethical boundaries that you need to have in a role like this. And to get through it, and to be honest with you, I fight with myself every day about what I'm doing. But I know that for me to feel okay with what I'm doing every single day is to know that there are people out there, they're just not getting connected to the resource. There are always going to be people who need our level of care on the inpatient or outpatient side, and sometimes they just don't know where to go. So that's how I get through the sales side of my role. Into the fun part is, like I said, with networking. Networking is huge and very important. But before I get into that, I wanted to see if there was any questions from anybody before I get started into networking and the importance of networking.
Oh, thank you, Kayla. That's amazing. And how do you deal with the like what you see? Do you compartmentalize it? What you've seen to not, I mean, I'm sure you don't want to become numb, but you don't want to also have the pain of like going home and seeing the things. I mean, from working with 11-year-olds and then 12-year-olds, and now you have to stay with 13, but knowing that they're so young, how do you work with that? Or does peak view behavioral health help with that as well? How have you learned to work with that
Yeah,
personally?
great question. And it is something that we talk about a lot in the behavioral healthcare field, whether you are starting off as a behavioral health tech, which is one of our entry-level roles. All you need is a high school diploma or GED. And burnout is a real thing in a lot of industries, but in behavioral health more so than others, because we are constantly seeing people on their worst days. And we are sometimes the symptoms of their mental health diagnosis makes them very aggravated, or they commit assault on some of our employees, or we just hear really intimate stories that clients have gone through and have to know what we can do with it, right? So I get the best support from coworkers, because we're not breaking confidentiality that way, and other supervisors, so that you can talk about what you just heard and what's coming up for you, kind of like you were in a therapy session for therapists, pretty much.
Yeah.
And the other one is just building resiliency. So resiliency is huge in this field. We have to know what our own boundaries are. So if we identify early on in our career that there's a certain diagnosis or population that we just can't work with. For instance, I worked with domestic violence offenders. Not everybody can do that type of work when they hear the story of what that client in front of them might have done to their significant other. And it was really how I approached it, was taking it from a stance of everybody is good, but sometimes we do unhealthy things, not necessarily bad things. They're just unhealthy. It's an unhealthy way of thinking. Domestic violence in particular, most of the time, the reason why people exhibit some of those behaviors is because that's what they saw growing up. And we will always do what we saw as growing up, because that's what we see as normal. So we'll start to bring that into our adult relationships. And it's really just reteaching yourself on your own beliefs and biases. Say resiliency, making sure you have a good support system, and then checking your own biases and beliefs would be the three major ways to kind of cope with what you see on a day-to-day basis in this field.
Thank you so much for sharing. That's amazing. And I know I didn't mention this earlier, but you do work with Peak View Behavioral Health as, like, I didn't want to get your title wrong because it's important, your business development representative. So in these courses, I mean, we work with K through 12th grade students, the counselors, teachers. How are we able to expose them to the programs? I know that, we don't know what's out there. So we're trying to just, once we find out, we're trying to expose them more to like, hey, this is where we can go. This is what we can do. Of course, I can send an email, but what's another way like that you can let them be aware of the things that you know now?
Yeah. Also a really great question because so Peak View Behavioral Health, we have 3 reps doing what I'm doing. So there's myself and 2 others, and all of the inpatient hospitals here in Colorado also have reps working on the field and working in the community. And then most outpatient programs also have reps, and their entire purpose is to help those that may not know the resources or know really what behavioral health entails and where to go when someone is struggling. Because if you take a Google search, 10,000 things are going to pop up and you're not going to know where to start. So getting in touch with any of the reps in the state of Colorado is a really great place to start so that you can better understand the resources. And I know all of us are more than willing to come into schools, and we do go into schools pretty often. And then like the hospitals and any other settings where students may gather. So if there's like a teen center, we'll go in and provide the resources, but share about behavioral health. One thing that everybody on my team is trained in is something called QPR, and it is a suicide prevention technique. And so we do those trainings free. And it's a very short training, actually, it's about an hour. So if you think of CPR, QPR is the training for our brain so that we can make sure that somebody is okay if they're exhibiting any types of signs of suicidal ideation, which just means suicidal thoughts. And then there's other ways too that adolescents and students can get a little bit more understanding of behavioral health, especially if you're seeing it in your schools and in your peers. There's QPR trainings, but there's also something called Youth Mental Health First Aid. And it's very similar to QPR. It's a little bit longer of a training, and you're going to go over how you can understand all of the different mental health diagnoses and the symptoms that they may present. So that way, if you are talking to somebody and you're noticing something and you may see, oh, this person is so off or so weird, you can start thinking about it a little differently of, oh, that's because I'm not understanding this person's diagnoses and why they may act a certain way or appear a certain way in front of us.
That's awesome. Taking my notes here. Yeah, thank you. So Gina, if you don't have any questions, you can move forward to your next section.
Yeah, that's good. All right, now we get to move into the fun part, which is something, when I talk about networking, it's something that I feel I heard so much about and never truly understood the importance of it. But in my role now, a lot of it is networking because I need to know who we can refer out to if we're not the best option for somebody. And then vice versa, other people need to know what services are out there. This is something if you're thinking of a career in behavioral health and you're like, I want to go be a therapist and do private practice, which sounds like a dream. There is a lot that goes into it, but people do it. And there are a lot of private practice therapists here in the state of Colorado who are very successful in their practice. And the one thing that sets those people apart and are able to be so successful is that they really took to heart networking and making themselves known into the community of who they are and what services they provide. Networking helps in various ways. So, for instance, I'm part of the alumni community with MSU Denver, and they host different networking events every single month. So they do women in healthcare or just professional women in general, or they do men, or they do an LGBTQ groups. They do everything that you can think of, and there is networking for pretty much every field out there. Networking is a good way to get your feet on the ground and your name into the industry that you're looking to join, especially in healthcare and behavioral healthcare. It can be pretty competitive in certain areas. So if you have some sort of way to get into any sort of networking event, just to meet with somebody and talk about what they do on a day-to-day basis, because what a therapist is doing day-to-day looks a lot different than what my day-to-day is now, or what a case manager is doing, or a tech or a nurse. Because there are nurses too. Psychiatric nurses are a thing and they are wonderful. They're like the backbone of our hospital. We also have recreational therapists, which I always envy because they get to play really fun games all day. And they do music therapy and art therapy. But there's a lot that goes into any hospital, whether it is a medical hospital or a psychiatric hospital. We're making it seem like it's just another day. And we try our best to do that with all of our staff being as normal and human as possible, right? We just need to show up authentically as ourselves. So I will say I missed out early on in my career by not attending some of these networking things just to get a better understanding of what is this career that I'm interested in and is it a good fit? It's a great way to meet with other professionals that if you're thinking of a certain industry that you want to go work with, you can go to a networking event, meet with somebody who's pretty established in the field and ask them, can I shadow you or do you know somebody who I can shadow? Job shadowing is the number one thing that I recommend to anybody before you commit 4 years of your life or 2 years of your life to studying in a certain field, because you could love and love the educational side of it all. But then when you're out in the field, it's not the same. And you find out it's not what you wanted, so you wasted some of your time. So I don't want that to happen to anybody like it happened to me. So if you have those opportunities to shadow or just talk to a professional in the field, absolutely recommend that. And I kind of just mentioned some of the roles in behavioral health, but I'll go a little further. I'll start with the roles that our hospital have. That is, and there's, I think, like 8 now inpatient hospitals here in the state of Colorado, and they all are structured pretty similarly. So entry level, if you wanted to just get your feet on the ground into an inpatient setting, which is not for the faint of heart. We are seeing people in a crisis stage short term. So you don't get to see that long-term result of somebody starting treatment, finishing treatment, and feeling like they're in a better place in their life. We unfortunately don't see that on our end. But there is what's called a behavioral health tech. So techs are the ones working on the ground day to day with all of our clients. Our techs are helping clients get to their meals, do some of their daily activities of living, make sure that they are going to their groups that they need to go to. They're doing process groups with them. So our techs do have the opportunity to get their hands dirty a little bit with some of the clinical side by running some of those groups. And then they will make sure and be that person that the client needs if they need someone to talk to, because techs are in the facility 24/7. Our therapists, unfortunately, are not, and neither are our psychiatrists. They work like 7 to 7 p.m. So if it's after hours, our techs are the ones that our clients rely on the most. And it's the entry level role. So it's sadly the role that probably makes the least in our field, but is the most important, I would say. From there, we have therapists, of course. Therapists are going to require you to complete your bachelor's and a master's in counseling. A lot of places accept internships, so you can still be in that process of your master's in counseling. Or what else can they do? I've never mind. The other thing is intake or admissions. So we have intake coordinators. An intake coordinator is going to be another one of those entry-level type roles, so only would require a high school diploma or GED. Our intake coordinators are the ones that are going to be processing all of the referrals that are incoming to us, which is about like 1,000 a month. So they're shielding definitely a lot of phone calls, mostly from emergency rooms and other providers or schools. They make sure that the client that they have in front of us is the right person and that we're the right fit for them and that we can accept them. From there, we also in admissions have our intake clinicians. Intake clinicians do not need to be licensed, but they do need to have a master's degree, but they do not have to have their licensed professional counselor, also known as an LPC. They don't need their LAC, which is a licensed addiction counselor, or a licensed social work, clinical social worker. They don't have to have the license side, but they do need to have a master's. We have nurses, so anybody with an RN, if they chose, they could go for their master's and have a specialty in psychiatric nursing. It's not necessary or required. And then we have nurse practitioners, which do have a specialty. So they're psychiatric mental health nurse practitioners, which means that they have prescribing power and they understand psychiatric diagnoses a little bit more than an RN who didn't specialize. And then, of course, psychiatrists, if anybody's interested in going through medical school and residency, bless your heart, we definitely need them. So that is another option. Our psychiatrists are there. In our setting, they are typically starting clients on new medications and monitoring the effects of those medications throughout their stay. And then we have case managers or discharge planners who are doing all of the aftercare that we have for our clients. And they typically only need a bachelor's degree for a case manager position. We have housekeepers, kitchen, rec therapists. I think right now we have 8 rec therapists on staff, which is quite a bit. I think 2 of them are actually interns, but the rest are all licensed recreational therapists. So they have their bachelor's degree in rec therapy. And they definitely go above and beyond, and I would say are probably the backbone of any hospital setting, whether it is behavioral health or if it's long-term care. That's a role that I had back in the day. I got to work as an activities assistant in a nursing home, got to play bingo all the time, which was really fun. And provide the socialization for everybody. That's their main goal, is to provide the socialization piece and then the physical piece. So move your body, do yoga. And that's just in our hospital. But there's other roles in behavioral health that you can do, like case management, as I have mentioned. There are a variety of different areas that you can work in case management. And behavioral health doesn't just include mental health disorders, but it also includes substance use disorders. So here in the state of Colorado, we also have an abundance of substance use residential facilities, and those will also have their tech roles, and they will also have their case manager roles. The state has case management roles. Department of Human Services has case manager roles, and typically those are entry level, requiring either a high school diploma or a bachelor's degree. There's so many ways that you can work in behavioral health without having to work directly with clients too. There's a role like mine where you get to be out in the community, but know you're making a difference for quite a bit of people. And then, we can get into the really fun stuff, working with insurance, our operations, making all of the things run and function, compliance, making sure that we are staying up to date with all of the laws and policies that happen. And then HR. You can always work in HR, honestly, in any field, but behavioral health, I would say, is probably the most rewarding HR role that you can have, just because you really are helping connect people to their path in behavioral health, but also these people are going through quite a bit on a day-to-day basis, working with the clients that they work with, and they get to be that person and support system for pretty much everybody in the hospital. But I think that that's a little bit about all the roles that you have. I don't know if you have any questions, then I'll just talk about really quick how you can get started in behavioral health and what kind of degree options are out there.
Yeah, go ahead.
Okay. So lots of options for behavioral health and degree options. One of them could be obtaining your bachelor's degree in human services or counseling or psychology. There's also a bachelor's of social work. Bachelor's of social work degrees typically are going to require you to have internship hours as well. Same with the program that I did ever at Metro. And so you get to see what it's like. And when you graduate with your bachelor's in social work, because of your internship hours, you're typically kind of catapulted a little bit more into some of those roles that sometimes require even a master's degree. And then in the master's level, if you're thinking, I want to be a clinician, I want to be the person who can sit there empathetically without bias to listen to somebody and help them through what they're going through. You can do your master's in counseling to either get your licensed professional counselor or your license. You can do master's in psychology. Just if you do that and you're thinking clinical side, make sure it's a clinical psychology program. Otherwise, all you just did was learn the basis of psychology and not how to be a clinician. There's addiction counseling. So that will leave you with your licensed addiction counselor. Marriage and family systems, which is the most tedious of all the licensed mental health professionals, just because of their degree requirements for their master's level it's pretty high up there in the credits that you need. And then they also have the most supervision hours before you become licensed. And then if you really wanted to take it further and you just love what you were doing, your PhD in psychology, or go to school and be a psychiatrist. I envy people who got to do that, but I don't have 4 years of my life to sit in medical school and then residency. So I think that I touched on pretty much everything that I wanted to. I don't know if there's any other questions or things that I left open-ended that you wanted answered, but here they are.
Yeah, in your roles, Kayla, thank you so much for sharing. I think you answered questions that I had without even asking them, so I appreciate that. So here we have what we do, call North Star Skills through Generation Schools Network. And so tell me, in your role or in the field that you're in at PQ Behavioral Health, is it the leadership, integrity, and communication? Can you just touch on those in regards to, I mean, I know you were talking about like confidentiality and having therapy sessions with the therapist there to avoid any type of mixing the information, or not mixing, but just exposing. But what in your field, and because it's such a important field, how you work with these three: leadership, integrity, and communication?
Yeah, so I'll start with the integrity piece because I think it is the most important in a behavioral health role. Clients are putting a lot of trust in you, and if you build a great rapport with the person sitting in front of you, they are likely going to be opening it up more than they have with anybody before. And you start to develop what's called a therapeutic relationship. So this one is really important that you have your therapeutic boundaries set at the beginning of any meeting with any client, whether you're working as a tech or you're working as a clinician, or you're even working in a role like mine. We need to ensure that we remain in that therapeutic relationship space and we don't let it cross into our personal lives. So we're not adding people on Facebook and we're not buying things for people because they need it. Or if we have a room open in our house and we know that our client is struggling with finances and needs a place to stay, we're not offering it to them. And so we have to act with integrity every single day in every client interaction that we have. And then in my role, I have to act with integrity to uphold the values and the mission that Peakview has, and ensure that I'm not overselling or overpromising something when I don't have the end all say in what we do at the hospital. Communication is vital across any role in your professional, and even as you are going through school, communication is the way that we share our needs with others. And so if we are skirting around things or we're not being clear with what our needs are, our basic needs, there's going to be a lot of miscommunication, or we're not going to hear what the person is saying to us. One thing that you start to learn when you are working as a therapist is the difference between active listening and just hearing. Hearing is you just talking to me and I'm not taking in any of it, and active listening is me really listening, putting everything that's in my head that's running around all day, putting it to the side so the person in front of me who is sharing whatever they need to share has my full attention and knows we can work through whatever's going on together, and I'm not there to just say, okay, cool, that was a great conversation, and leave when they were asking something from me. Communication is also really important when I'm out in the field, because I need to know how to present myself and communicate well so that the referral sources can trust me and trust what I'm saying, and know that I can speak the language. So working with therapists, there's so many terms that go out there. We need to know what all of these acronyms mean. And so when I have a meeting with a therapist, it looks a lot different than when I have a meeting with just a primary care physician, or even if I'm doing presentations or meeting people out in the community that are just general community members. They don't know what IOP or PHP or LCP, LAC, they don't know what those mean. So ensuring that I have clear communication across the board. And then, I'm sorry, what was the third one? Leadership. Yes, leadership. Leadership, I think, is almost undervalued in some ways, that we see leaders as they're in their little ivory tower and they make all of these decisions that impact us. But we can be a leader every single day, and it doesn't mean we have the title of CEO or director X, Y, and Z. We are a leader in our own lives. We lead who we are, and we get to lead others in their paths that they want to take. Being a leader really is being somebody that they can trust and want to follow, and that you're leading in a way that is up to your values and your integrity and your strengths.
It is wonderful. I think that's wonderfully put. Thank you so much. Gina, did you have anything that you wanted to say?
My internet's been unstable. So um, I appreciate everything that you went through as well, Kayla, especially with your own story and how you navigated, some challenges that came up that you found, and you found the right path for you in healthcare, in behavioral health. And I know you mentioned lots of different positions and careers within behavioral health, but are they all in great demand right now?
Yes, absolutely. So there is a high need for almost every role in behavioral health. Nursing shortages are pretty much across the board, whether it's behavioral health or mental health or substance use or medical. There's just a shortage of nurses, and I think we've seen that since COVID. Our techs, like I said, it's the most demanding role that we have and often doesn't pay as much as it probably should. So that's one that is always in demand. And right now it's hard to believe, because when I'm out in the field, I go into a building and there's 20 therapists, but we are in a therapist shortage, and not so a therapist shortage in terms of we don't have enough. We just don't have enough who are meeting the needs of the community. So providers who accept insurance, who accept Medicaid, who accept Medicare, those major ones.
Gotcha. And is there any special advice that you would have to a student who is interested in pursuing a career in behavioral health, but maybe they don't know exactly where they fit or what they want to study?
Yeah, absolutely. I would say attend. I host so many networking events, and there's so many around the entire state of Colorado. Attend one of those networking meetings, because most of the time you're going to see people who come from a variety of backgrounds and now are in a certain role, like a rep, where we just so happen to have to go to those networking meetings. But also to get connected with your local behavioral health resources and see where you can volunteer. A lot of suicide hotlines always have volunteer roles. Most community mental health centers have volunteer opportunities. And then if you wanted to take it further on a more grand scheme, there's NAMI and a few different, I think every county has their own suicide prevention organization. So here in Colorado Springs, it's Pikes Peak Suicide Prevention, and they always have opportunities for volunteering, as well as different teen support groups and boards that run. So that way, what we're doing when it comes to suicide prevention is in line with what kids actually need.
Great. I mean, that's all I have. I want to thank you, Kayla, and Peak View Behavioral Health, just supporting us, coming here to speak to our students and staff from different schools, and being able to reach out if needed, and just having resources for that. And I really do appreciate all your time. I don't know if you have any last words before I stop recording.
No, I just want to thank you all for taking the time to listen to me talk at you for 40 minutes. But know that it's okay to not know what you want to do, and it's okay to ask questions and be the person in the room who wants to know more if there's something that maybe slightly interests you. Thank you.
Wonderful. Thank you, guys. We'll talk to you soon.